People should all have equal chances. If we really have equal dignity, we should have equal chances to go safely through pregnancy and childhood, to be a child and be born into this world and grow up healthily with all our immunizations and with safe water and sanitation and with adequate nutrition and shelter.
Sometimes the program cannot reach all the households, because you will see the poor people, they usually live far from the main centers, right? The poor people, they live on the mountains, right, where you don't have access. Or the poor people or the lower caste people will be living separate in a small areas. So because of that, the access is always a problem for them.
The social barriers as well as the physical geographic barriers to achieving access to care and facilities are really substantial, and particularly when you're talking about having to travel 4, 6, 8, 10 hours for a service.
More of the middle class is getting access to services. The larger urban population centers are being built up and favored. But the poor and the most marginalized and the people who live in remote rural communities are not benefiting from these advances.
There are a large number of people falling into poverty, so new poverty is being created even as some of the existing poverty is being removed. Large numbers of people have fallen into poverty mostly on account of the fact that they had an illness, a chronic illness or a severe illness or more than one illness, and spent huge amounts of money paying for the treatments, often losing their assets in order to pay for those treatments. Of course, illness is not the only cause, but it's a big contributing cause to people falling into poverty or people being unable to rise out of poverty and remaining poor. Factors like bad health, high healthcare costs, in some countries, funeral expenses, expensive wedding ceremonies, in other countries, droughts, crop failures, commodity price fluctuations.
Core Group advocates for a community health approach. One of the aims of a community health approach is to ensure equity between advantaged people, disadvantaged people, between the rich, the poor, people from one tribe or another tribe, so that they have the same access to healthcare information, services, and quality supportive care.
These community health workers are very crucial to really reach those underserved population, the lower caste people, the poor people, it's very important, to have the community health worker.
Most of the NGOs who are members of CORE have been doing community health worker type of outreach for decades, and almost all of it is around reaching those people who are not only poor or rural or remote, but neglected by their own governments.
Working at the community level is an important way to achieve equity in health, in part because at the community level you're able to access leaders who know the citizens, the residents in the homes. They understand the needs of the people who live in the area. And at the community level also, this is a great way to mobilize those residents through their local leaders. There's a level of comfort, a level of familiarity, and I think it gives an opportunity for those even in small areas in rural communities to have an opportunity to access health.
You are the ones who see the global recession inscribed in the bodies of malnourished children. You are the ones that see social pathologies embodied in individuals' conditions and how it plays out in people's lives. So you're the ones who can, in a sense, make the biggest difference